What's up, everybody, and welcome to this week's episode of the Well Man's Podcast. My name is Brian Brosey. I'm joined by my friend and co-host, Keoni Tita. Keoni, how are you today?
Good. Hi, everybody. Thanks for being back with us today. I'm excited about this topic because I see it quite a bit.
Yeah,
And
all too often, unfortunately.
yeah.
So we're going to talk some of the muscle syndromes. We talked about lower cross syndrome on a previous episode, maybe four or five episodes ago or so. So you can go check that one out. But now we're going to talk about the top, upper cross syndrome. And unfortunately, if I had to, I think they're both pretty common. They're both syndromes. They're not specific diagnosis. They're pretty common within the general population. But upper cross syndrome, I would say, and this is my opinion, is more common than lower cross syndrome, just in how we sit all day and the muscles that end up getting overused or tight, and the muscles that end up getting inhibited or weak. So we're going to kind of break all that down for you here.
Yeah. Are we talking about upper cross, head forward, tight back muscles, that type of thing?
That's exactly what we're talking about. So it's also known as
see it all the time.
Right. We see it all the time, and it becomes super noticeable when we see it in those who have aged and dealt with it for a while. They get that forward head posture, that rounded shoulders, and it becomes extremely obvious even to an untrained eye.
Okay.
So upper cross syndrome is also known as proximal shoulder girdle cross syndrome. And like we talked about on our previous episode, we make like an X pattern of weakness and tightness across the pelvis. And here we're talking about it across the shoulder girdle. Before we get too far into it, I would like to mention I've been doing exercises that coincide with the lower cross syndrome podcast on our Instagram. So if you want to check those out, it's the Well Man's Podcast on Instagram.
Yeah,
and I'll certainly be bringing some exercises from this topic to there. So if you're looking for exercises about what I'm talking about, check out our Instagram, and they are there. But so X pattern of weakness and tightness. So in upper cross syndrome, what are we talking about? We're talking about that X pattern, the tight muscles being the pec major and the minor, and the tight muscles being the upper trap and the levator scapula, as well as our suboccipitals. So just to break those down, the pec being the very front, being tight, that would give us that forward rounded posture. And then very tight kind of in the back of our neck, if we think about our shoulder blade up, essentially, is where you see that tightness. The suboccipitals are small little muscles that attach to the second spinous process of your spine and go all the way up to the base of your skull. So really small, intricate muscles there that are involved and that become tight, and they can cause pretty bad tension, headaches, and that sort of thing.
So if you're looking at a side view of a person, you're talking about that cross right at their shoulders and pointing up to the front toward be your chest.
Yep. So the
down
tightness
towards the back, your traps. Yeah.
The tightness would be up, and then the chest would be below you because you're going to actually have weak neck flexors. So just thinking about our line of tightness here, it's going from the chest up to the base of the skull. It's kind of how we're drawing that line, if that comes across verbally.
Yep. Okay.
And then talking our weak muscles, we're going to break each one of the muscles down here shortly, but talking our weak muscles, the deep cervical flexors, often a forgotten about group, the longest coli and the longest capitis. Some interesting muscles there we'll talk about. And then the middle and lower traps. So that's kind of our middle and lower back. And then with this isn't necessarily, it depends who you ask or whose opinion you want on if these muscles are considered within upper cross syndrome, but the infraspinatus and the serratus anterior are definitely going to get inhibited or weak in this posture. And why is that? The infraspinatus is our primary external rotator. So being our pec major getting tight, we're getting this internal rotation of our shoulders. So we're already kind of messing up that muscle length tension for the infraspinatus.
So we're talking about the shoulders rolling forward?
Yep. So then, shoulders rolling forward. And to give everyone a good idea of this forward head posture, if you want to do it, roll your shoulders forward, keep your neck where it is, and try and look up. Let's say you're in the car, try and look up at the rear view mirror, or if you're looking at your computer, you're really looking up. So you've kind of increased the lordosis in your cervical spine, so kind of that backwards curvature, and then you've also rounded your shoulders forward. So if you really do this to the extreme, you can imagine how uncomfortable it is, and easily see how you get further hiked up in your shoulders and the weakness in your middle back and that sort of thing. So why is it important, though, to mention the infraspinatus and the serratus anterior? They are part of our rotator cuff, the sits muscles, the four that make up our rotator cuff. So already we know with this syndrome, we're going to have decreased control of the scapula. And that is going to cause a host of problems, or can cause a host of problems. And that's going to be in both static and dynamic states. So we need to retrain these muscles when we see this syndrome.
And can this can translate into shoulder pain? It sounds like, if you're hitting that shoulder, the rotator cuff, right?
100% shoulder pain, shoulder impingement. It can also, like I talked about with the suboccipitals, and I know I've talked about this person before on the podcast, but I had someone when I was at Auburn who was a personal training client of mine who was on a variety of migraine medication, and it ended up really just being some tight myofascial stuff, some tight muscles, and the connective
That's
tissue.
so much more common. That's so much more common than people think too. A lot of their headaches are due to this.
And that would fall under this syndrome. So
yeah,
that's why it's so important to cover. So just to review it really, really quick, the weak ones: deep cervical flexors, middle and lower traps, rhomboids, and infraspinatus and serratus anterior. So again, that straight line there, the weak one is starting at the top if we're looking from front to back, top being in the front of our neck, so above our clavicle, and then the weakness is happening in between our shoulder blades in the back, essentially, or in regard to our shoulder blades. Just to go over some quick anatomy with the tight muscles, just so we get an idea of how we're getting this forward head posture. We'll be really, really brief. We know that the pec major attaches from either the sternum or the clavicle and comes and attaches to a point on the humerus, the greater tubercle there. And so that rotates you inward. That's why that's important. So it's going to cause that inward rotation of the shoulders and possibly that hunching forward.
Yeah.
And then the suboccipitals, like I talked about, attached from the C2 spinous process, that second vertebrae in your spine up to the head of the neck. And if those are really tight, you're pulling your head more into that extended like position.
Yeah.
That's where a lot of that neck discomfort or headaches can arise from. Next, we're going to go through the anatomy of particularly the weak ones. And this is important because it's going to tell us how we're going to work them. Okay. So the longest coli and longest capitis, all we really need to know is they attach in the front of our neck. So they're attaching to very specific points within the front of our neck. The longest coli attaches to the very top of the neck. It ends up attaching to the first cervical cervical vertebrae, C1. And then the longest capitis, because it's capitis, is the only one that actually goes to the cap and attaches to our occiput. So that one's actually flexing the head.
Okay.
Then we have our middle traps and our lower traps. Those attach into our spinous process and then to the points of the scapula. So we can see winging of the scapula with weakness of these. And people generally have kind of back pain in this thoracic region where they feel like if they've been sitting for a while all day at the computer, they do kind of that backwards bend. They feel like something in the middle of their back needs to pop. The reason we kind of see this typically being uncomfortable here in all these spots is these areas that we're talking about are where the joints start to change kind of their morphology. So we know they ride each other, the joints fit each other in very specific ways throughout the spine. And in specific instances, like when we're going from the low cervical spine to the high thoracic, we're undergoing a change in how the vertebrae are going to interact with each other. And that's why we can see some more dysfunction and pain in these areas. Does that make sense, Keoni? We're talking about like the orientation of how they move on each other.
Yeah. And over time, are you actually changing structure over time if it goes on long enough?
If it goes on long enough, you certainly are. I mean, that's where we see things like stenosis creep up, and you're getting pressure where you don't want pressure, and slowly the body's going to respond to that pressure by building something up, whether it be, osteophytes or some sort of bone growth or something that is going to put pressure where you don't want it, and you're going to have to deal with pressure where it's not supposed to be, which is how we get injury.
So in some older individuals, right, this bent over posture, can it ultimately be due to this?
Well, I absolutely. So I think, and this is what's so great about syndromes, right? We're not given a diagnosis, but it's saying, a collection of these sorts of things are going on here and causing this orientation. And obviously, the more you're in these positions that we've kind of been describing, if you did that in the car with us, the longer you're there. If we think about further weakening the muscles behind us and we're more easily rounding forward, plus they're only getting tighter, that's how we get these unfortunately some very old people that look very, very old when they walk, and they're not really moving and
Right.
rotating well, and their head's super forward, their shoulders are super forward. So absolutely.
Okay. Yeah, that's
Absolutely.
important because we spend most of our lives, right, in this type of thing.
Exactly. Exactly. So we do spend most of our lives kind of with the tight pattern becoming more tight. You know, we're working our pecs, we're typing on the computer, all of that's in
We're
front of us.
sitting most days, right? We're driving in the car. It all kind of like puts us in this position, sort of, if we're not aware.
Right. That's
Of our
why I think this
posture.
one's more common than the other one, just because it's so today's society. You know, if you're typing on your computer, you're internally rotated to get your hand flat and type on the computer. If you're
Yeah.
looking up at your computer screen and it's not at a perfect position for you, you're working those suboccipital muscles and putting them into a little bit of extension, and you're just
Right.
slowly feeding into this. And what we're going to give at the end is kind of how you know, some daily things that you do to undo this. But all too often, Keoni, a patient will come in and really this is, you know, they have a shoulder pain or neck pain, and that's what they're coming in for. But it's all just due to you've been doing this posture for the last 4 or 5 years. And maybe
Well,
something's coming up like stress.
I gotta tell you, like most of my patients who come in with shoulder pain and neck pain, and like you said, even headaches, it's due to this.
Yeah.
It's ultimately due to this. And you know, when they go to their doctor, they're getting what, like a headache pill or what, or you know, a steroid injection or an
Right.
NSAID, right? Yeah.
Right.
So it's easily correctable, I hope, if you catch it early enough, I would
Yeah,
think.
absolutely. And we're going to talk about how to do that. It's important to know in the shoulder girdle and with a lot of these muscles we're talking about that we have this concept of a force couple where muscles are kind of working together. So you can't always say that one muscle is doing this, one muscle is doing that, because if I do an action, the other side is somewhat controlling that. For example, if I'm lifting my shoulder, I'm having muscles work to lift my shoulder, but I'm also having my serratus anterior, one of the muscles we mentioned, hold my shoulder blade down so it glides well as I lift my arm up and glides like in a healthy
Right.
fashion. People see winging of the scapula where the scapula almost looks like it's like escaping the back from the middle there.
Yep.
And that's due to that serratus weakness, or can be due to that serratus weakness. So again, all of this plays even further into pain and having problems later down the road.
Okay.
So that force couple concept is just important to know that these muscles are not functioning in isolation. So it's important to train them in isolation when we're just beginning, but eventually when we're working on actually doing some treatments, you need to be doing functional movements and really rehearsing the sequencing and the firing pattern of these muscles to make sure it stays and becomes functional. So starting isolated, but moving to a much more functional type position. So we've talked about this specific postural changes. That forward head posture is going to be really seen here with people with upper cross syndrome. An increase in cervical lordosis, which is that curve in your lower in your neck, that C curve in your neck. And then a thoracic kyphosis is going to be increased. So we can think about, again, our rhomboids, those middle muscles of our back becoming weaker, and we're slowly inking forward into a more forwardly rotated position, and we're increasing the hump of our back, the thoracic kyphosis.
Right.
We also see, and this is what I'm bad at, is elevated and protracted shoulders. So the shoulders inking forward again and elevating. I know it affects me with stress. So I'll catch myself really hyped up here, and I need to relax
slowly creep
down.
up, right?
Yeah. And then we'll see some winging of the scapula, possibly rounded shoulders, all that kind of stuff we talked about. And overall, this decreases stability of the glenohumeral joint, which just is kind of interesting, Keoni. We've heard the ball and socket joint. We know that there's a variety of ball and sockets in the body. But if we look at the shoulder, it's just super interesting to think about, because there's two really stark contrasts. You have the hip ball and socket joint, and you got the shoulder ball and socket joint. Well, the hip ball and socket joint is great because it's like a very, very small, like a pea going into a shot glass, right? It's got it's really deep in the fossa.
Right.
Whereas the shoulder is still a ball and socket, but it's a lot more like a golf ball on a golf tee. So there's not that inherent stability of being so deep into the cavity of the joint.
Yeah.
So you need this muscle stabilization to work dynamically and statically to keep that golf ball on the tee, because there's not as much room as there is at the hip, for instance.
Yeah, I guess it makes sense, right? This is probably why, people popping their shoulder out of joint is more common than you would see with the hip being popped out of joint, I would think, right?
Absolutely. Yeah, absolutely. You're far less deep there. And like I just mentioned, that image just sticks out to me so much as the golf ball on the golf tee versus like a golf ball in a
Yeah,
shot glass that can fit all the way down. And that's the difference between your hip and your shoulder. And that's exactly why you see those dislocations, but why it's so important to get these force couples coupling together correctly. And you can break down these force couples in a variety of ways, but one of the ways is in this pattern of weakness and tightness. So what's the treatment, or how do we go about treating this? I mentioned that we want to train isolated to begin with, because we need to acquire kind of a cognition of how these muscles fire, where they fire, when they fire, and what type of quality and purpose that they fire with. And that's why I kind of went over a little bit of the anatomy so we can get an idea of what we're talking about here. And that way you build that mind muscle connection. You get a lot of people in outpatient physical therapy who, the exercises are so boring. And it's like, well, they kind of are, because we're retraining very, very small specific things to fire well in the grand picture. In the grand piano, or the grand symphony here, we're working on with the pianist.
right.
So we really
So
got to get
so
that
we're
down.
isolating these muscles. So you'll see shoulder exercises that just help you become aware of what muscles you're moving or how the shoulder joint moves. So we're not talking about big like shoulder press movements or anything like that.
Right. Up until later, once we've
Oh,
rehearsed that piano to the point where now we do that shoulder press and the muscles are all firing well and coordinated and everything's a great orchestra.
yeah.
So the big point being, we're going to focus at the beginning on very specific movements, high quality movement. And we're also going to think about doing prolonged holds and endurance repetitions, because these are more postural muscles. So by nature, by their muscle physiology, they're going to be less likely to tire, and they're going to be more likely to kind of work over time for a prolonged period of time, as opposed to, thinking of a muscle we're going to use when we're sprinting as fast as we can.
Right.
So another focus of the treatment, again, is that internal. So we acquired some cognition of some very specific isolated movements. We're going to build that muscle to brain connection, get that quality communication down between you and your body, and focus on the internal focus of the scapular muscles. And then this one's huge, Keoni. This one I have trouble with myself, is doing respiration control while you're doing all these. So we don't want to be holding our breath. We don't want to be, all nice and tight and really just focus on only doing the exercise. And then we only breathe when we relax. You need to be able to do these exercises and maintain a nice, healthy breathing pattern to actually develop, like we were talking about, the orchestra. So
Right.
once you start breathing, you start hiking up your shoulders again, which is very common for me. That's when I need to really focus on actually maintaining that posture while doing good, high quality breathing. And we know, Keoni, that good, high quality breathing starts in your belly. So your diaphragm,
Yeah, it's the
like a
belly breathing.
parachute, balloons down, and thus your belly should push out as you breathe in. And it should start in your belly, not in your chest. And
Yeah, and
that's
that's so important for so many reasons other than this upper cross syndrome.
100%. And that's one of the things that can also increase upper cross syndrome, or kind of your likelihood to have it. If you're really breathing in your chest only, or
Yeah, where
you're
you're
kind of
breathing
mouth
into your
breathing.
shoulders. So yeah,
Yes.
that's right.
Yep, exactly. So getting that respiration and that control there. And then the final component being creating that orchestra. Now, if you're a lacrosse player and we were working on a specific muscle here, now we're getting it all involved in your lacrosse shot and making sure that the infraspinatus, just as an example, is firing well and incorrectly with how it's supposed to, and what, your shot motion or whatever the specific movement is. Now we're talking about pressing overhead and really focusing on shoulder motion and scapula quality of movement and those sorts of things. So now we're working on the orchestra.
Yeah. Okay.
So we're acquiring very specific cognition of very specific muscles and training that. We're focusing on our shoulder and scapular stabilizing muscles. We're focusing on breathing while doing all of this really well. So everything that we just listed, all that included, and breathing well and properly. Then we put it all together into the orchestra. and we're doing various movements while keeping all that maintained. And that's kind of our treatment approach. Our that's how we're going to go through in 10 weeks or so and solve this problem.
And that's usually what it takes. You should see a lot of improvement within 10 weeks.
Yeah, 10 weeks is a fair amount of time, I would say. So just to give everyone an idea of what adaptation times kind of look like, the first 4 weeks of your adaptation is neural. So that means like when you go to the gym and you've been doing a exercise routine for 3 or 4 weeks and you start to feel stronger in those 3 or 4 weeks, that's just muscle recruitment. You've somehow increased, whether it be firing rates, how fast the synapses are going, and then actually connecting to your muscle, or you're better coordinated with it. It's a neural adaptation. At about 6 weeks or so is when you start to see physiological changes in the muscle. So that's where you could see cell hypertrophy, or possibly even some changes to the length if we're talking about the tight muscles. So 10 weeks, a good general overview. I've had people who've had shoulder pain, and within 2 or 3 weeks of getting them on a regimen that works against this, where they're doing it daily, they've had improved results. Now, does that mean it's completely gone? But within 2 or 3 weeks, improved.
Yeah, that's great.
So we went through how you're going to treat them. Let's talk some daily prevention. These are some really actionable tips. This is really, you're just at your desk, you're the everyday person. And these are some things everyone can do to kind of stave off upper cross syndrome. And this is some of what I give those people I was telling you about, Keoni, where they're not resolved, but they are much better in 2 to 3 weeks max, just from undoing kind of this posture that they've never undone, that they're in 8 hours a day, at least.
Yeah, at least is right.
Right. So we'll start nice and easy. Scapular retractions. If you're sitting there listening to the podcast, I want you to squeeze your shoulder blades down and in together behind you, almost like you have a pencil in between your shoulder blades and you're trying to squeeze it down and in and hold on to that pencil. Again, we're using that treatment approach of kind of knowing what the muscle does. It's a postural muscle. We want to work it where we hold that contraction. So when you're doing that squeeze, hold that squeeze for 3 to 5 seconds. Do high repetitions to begin and to keep it going. Then I call this like a supine back push. So this is, let's say you're laying fully down on your back, or you're sitting in the car. I want you to push your arms, your upper arm specifically, like the upper 2/3 of your arm, back into the floor or the bed. I do this when I'm laying in bed. And then tuck our chin and push our head back to where we're slightly pushing back. So this is really just kind of working all these extension muscles after we've just sat in this forwardly flexed posture. Right. Now, it's important here to keep that chin tucked, and we're going to talk about that a little bit more. But that supine back push is just a great undo of the day, because it's the opposite of all this forward focus that we have throughout the day, which is only natural.
So a good time would be right before bed. Do it once you're laying down.
Well, yep. This is something I like, how people count the sheep. I count the holds for this, and that's how I've slowly fallen asleep there, as I'm pushing my neck back. Everything that's laying on the bed, if I'm laying flat on my back, is kind of pushing back, and that's working the muscles behind me that are unfortunately not getting it worked enough throughout the day. And it's great to relieve back pain as you're trying to go to sleep, and kind of relieve that neck tension as you're trying to go to sleep. All of that good stuff.
Yeah.
Last, super easy, simple, a doorway chest stretch. There's plenty of these online. But you basically can go put your forearms in a doorway, and you can change the angles to where your hands are fully flat, like they're in your pockets beside you, but they're still on the door frame, or all the way up to where your arms are overhead, and just do a nice, slight, very slight lean into the door and feel it stretch across your chest. And this is something you can do as a reminder when you leave the office, or when you get up to go to the bathroom. Go to the bathroom, and on your way back to your chair, whether it be in the bathroom or whatever door you walk through, do that stretch for 30 or 40 seconds. And that's just going to make a world of difference throughout the day, instead of never coming out of that internally rotated computer type and posture.
Right. Yeah, I mean, these things you can do at any time, right? I mean, pretty much like that doorway stretch. If you're up and walking around or have to have a bathroom break, you can always find some place to do that.
Right. And that makes it easy and attainable for people to do it break it up throughout the day, which is great because these things are getting tighter throughout the day, and you're constantly being stressed in this way. And if you can take a break every time, every 2 or 3 hours or whatever the case may be that you get up and go to the bathroom, doing that stretch is going to work wonders for you. And it's just going to easily fit in your day. I'm talking 45 seconds.
Yeah.
Then another one is there's a trap stretch, which you can look up how to stretch your upper traps or your levator scapula. Basically, you're going to alternate how you're stretching those by which way your head looks. And you can look that up. I'll demonstrate it on Instagram Live, so that'll be there for you guys soon. And then a suboccipital release. I've got a great suboccipital release where I use a broom handle and 2 books, and it's on YouTube. So if you want to find that,
cool.
Brosy suboccipital release, and it should pull right up. And you can join me on the floor there, and I'll walk you right through it. So we're going to talk 3 or 4 exercises for strengthening. Most of those were basically stretches. We had scapular retraction, supine pushes, which are more active, which are going to actually work the muscle versus stretch the muscle in that way. And so the daily prevention is a nice dose of stretching with a little bit of strengthening. Now, if we want to focus specifically some more on the strengthening of these weak muscles, we were going to do like a YW. There's another exercise I have on YouTube that you can go find. You can Google Brosy pumping YWs, as Y is in yellow, W is in Walter. And this is an exercise that really forces external rotation, forces you to engage your shoulder blades, forces you to work on your lower traps, your mid traps, your rhomboids, all those things. And again, that video is on YouTube right now. So you can find that and start using that in your workouts immediately. And I'll prescribe it to people where I have them. So I've got a YW, and I've also got a pumping YW and a YW where you have dumbbells. And all of these, you can do them at whatever level suits you. So I would suggest, this is the first person, I would start by holding it for 12 seconds and moving to each position that I demonstrate in the YW at least 3 or 4 times while holding it up there for 12 seconds. And again, the YouTube video will have a lot more information. Another exercise that I love is a band pull apart. So here our hands are, palms are up, hands are out in front of us, and we're just opening our chest, squeezing our shoulder blades behind us and in as we pull the band apart across our chest. Again, we're focusing on scapular retraction, external rotation, all the opposites of what that syndrome is giving us as far as the posture goes: internal rotation, flexed, that sort of thing. And then here's where we talk about specifically making sure we tuck the chin well. So cranial cervical flexion testing is something we do in physical therapy to specifically address the longus colli and the longus capitis. Those are the 2 deep neck flexor muscles I worked on or mentioned. How we test these in clinic is we actually take a blood pressure cuff. We put it underneath the lordosis curve of your neck. So it's almost like a little pillow for you. And then we have you tuck your chin without turning on the global muscles. So the global muscle being like your sternocleido-occipital mastoid muscle. So that's one of the big muscles you see in people's neck. It's kind of it goes straight from the clavicle up to the kind of behind the ear there. And it's one of those big, thick rope muscles people see. If you're using that, you're going too much. So we grade millimeters of mercury by putting the blood pressure cuff underneath someone's cervical curve. And we want to only see 20 millimeters of mercury change to actually fire these muscles and specifically fire them and not the global ones. So what does that tell us? It tells us it's a very small motion. So if we're laying back right now, or even if we're sitting up, we're tucking our chin down, and that small chin tuck is probably it. Again, we're talking 20 millimeters of mercury here. So what you should be thinking about doing is you're flattening the lordosis curve in your cervical spine. So you are flattening it. But if you're holding onto your neck and kind of the sternocleido-occipital mastoid muscle we're feeling, if you feel that poking through, so really you shouldn't be able to feel the longus colli and capitis. They're like below your throat. They're really deep into your neck. You're not going to be able to palpate them. If you're feeling a contraction on your neck, you're doing too much. you're not focusing on the right area. This is,
You're not
again, where
isolating it. Yeah.
not isolating it. And we find that these are the ones that really stabilize. I mean, we broke through some of the attachments, and they're going from the front of the neck, the vertebral bodies, one of them all the way up to the base of the skull. So you can imagine how much that's controlling your flexion and extension there, specifically your flexion. And we want to use it safely and well as we
Right.
kind of chin tuck down. And again, you can use a blood pressure cuff at home to kind of do that 20 millimeters of mercury test. And then the ccft test, that craniocervical flexion test I mentioned, it involves that, and it also involves how long can you hold that position. And that speaks to the fact that they're postural muscles that are pretty much constantly stabilizing our spine. They're stabilizing our shoulder girdle. So that's how we want to train them. We want to train them for these endurance holds, 6 to 20 reps, postural, long times, that sort of thing.
So those 3 exercises are basically isolation exercises, right? For the most part, the exercises for strengthening or not?
Specifically the neck one,
yeah.
The YWs and the band puller parts, I would say, are not there. You would get a little bit more isolation and like scapular retractions, but even then, that speaks to kind of the force couple, where if you're retracting your scapula, there's a lot of things at play there. I wish I could tell you it was just one muscle, but it's not.
Yeah.
There are ways to train one muscle. And again, you want to kind of start there, or start with something like scapular retractions. That's nice and simple and easy. And then move into, for instance, that band pull apart, which is a lot more taxing, a lot more global. And you've got to kind of orchestrate that orchestra well to do it properly. Overall, these muscles are predominantly type 1, which means they're slow twitch, they're fatigue resistant, and that's why we train them, like I've mentioned. Prolonged holds, holding for a while, high endurance repetitions, really nailing down this pianist solo, so when it comes time in the orchestra, it shines. And that's what we're looking for with our movement here. The best thing I can recommend with these exercises is to check out Instagram Live, because I'm doing them all the time on the Well Man's Podcast Instagram, as well as any of the exercises that I mentioned are on YouTube, and I'm putting up more exercises on YouTube daily. Check those out at Brian Brosey on YouTube, and you can find those.
Yeah, that's important, Brian, because a lot of this stuff, it's hard to just verbally describe it. You really 100%. have to see it in action. And some of it sounds really complicated, but when you see some of these movements, they're very simple but powerful movements that anybody can do, as long as you have a little bit of direction.
Yeah, 100%. So to go along with this podcast, I would look up, you can just type in upper cross syndrome, go to images, and you're going to see the X that Keoni and I are kind of talking about when you're looking at someone's profile view. That'll give you the image of it. And then looking at my exercises specifically, and I'll be breaking them down on IG Live. That'll break these down even further. I know it's a lot, and we don't want to get caught in the weeds, but hopefully that was helpful. Gives you some idea of at least how you want to go about working them, and where you want to start, how you want to progress, and then obviously what muscles you're looking to address and how.
So Brian, before we end, tell me, I just want to go over some symptoms that I've seen, signs that I've seen in people, and symptoms. So you talked about headaches. That could be kind of due to this, like tension headaches and stuff. Any type of shoulder pain, I'd imagine too, right? Especially in the front of the shoulder.
Yep. Especially the front of the shoulder, because you're looking at impingement a lot.
And then what about what I call the pain that you get in the back, where it feels like a match is like being put out on your back? I hear that a lot from people, like this point pain or numbness, like burning pain. It's almost like in the levator scap area.
Yeah, so that could be a lot of, what I would say is that would be further caused by upper cross syndrome.
Okay.
It's probably something, if we're very specific on where that pain is, it may be something else or a little bit more specific, but it's certainly being exacerbated by this posture, because again, we're putting stress where stress doesn't belong.
Right. Okay. And then what about, somebody with I guess it kind of goes, but like with the Dowagers Hump type, stooped over. I mean, is that part of this?
100%.
Okay, so the Dowagers Hump, we kind of have it's like you're bent over so much that it's kind of like your upper thoracic, lower cervicals are kind of bulging out and creating like a hump, right?
Right. So in all those people, you're basically going to present with this syndrome.
Yeah.
I think is the
Okay.
best way to put it, because it's not, the syndrome isn't causing Dowagers hump, but
Right.
Dowagers hump is kind of a symptom of the syndrome, if that makes sense. And
Yeah.
they go
Yeah.
together.
Yeah. Thanks for making that clear. And then I also get this complaint. I get like people complaining of like fatigue here in these muscles. Like it's almost like a weakness or even a tightness sometimes. It just feel like they, I don't know,
Yeah.
weakness and tightness there.
And that to me is those sternocleidomastoid muscles, or those sternocleidooccipital mastoid muscles, the ones in the front that can get very tight, especially as you get more of a forward head, they become more tight. And then what you're doing is you're using those more so than that longus coli and longus capitis.
Okay. And then what about the symptom of, people complaining about numbness down into their hands, and, it's
Yeah.
almost like, and a lot of times it gets diagnosed as carpal tunnel, but it's coming from the neck, it seems a lot of times.
Right. So then you have thoracic outlet, but that thoracic outlet syndrome, that thoracic outlet can be caused or further exacerbated by this syndrome, where you present with this posture, and you can put pressure again, whether it be on the vascular or the neural structures that are all running right below your clavicle, as you decrease that space with your forward rounded shoulders, your forward rounded head. Even jaw pain can be a symptom of this, because you're bringing that head forward and kind of changing the alignment of how these muscles need to work in your jaw and putting a little bit more stress on them as well.
And then the other thing, as we get older, I've been seeing a lot in my clinic, especially I see it a lot in men, but it's almost like people have these rotator cuff injuries and have no idea how it even happened.
Yeah.
Can this be contributing to that too?
It can certainly be contributing. That's why I've felt like I had to mention serratus anterior and infraspinatus, because those are two of those rotator cuff muscles that are supremely important. And they're not always talked about with upper cross syndrome, but just by thinking about the posture, you're lengthening those muscles and making them weaker because they're not at their optimal length tension relationship. Okay. So it all compounds on each other.
And then the last one that I can think of off the top of my head, we did a podcast on this one. You talked a lot when we were talking about, I think you were talking about frozen shoulder. Can frozen shoulder be at least in part due to this, or not?
I would say no, just because frozen shoulder in its correct use is a lot more of a actual pathological situation going down within the shoulder joint capsule. Okay. And we talked about that at length of that podcast, so I'll leave it at that. But it certainly, again, can be, with frozen shoulder, you have a loss of very specific emotions, and that loss of motion is further exacerbated by poor posture.
Okay, so it may just add to the problem.
Yep. That would be the overall summary of these syndromes. That's why they're syndromes and not specific diagnosis. They're just kind of ways people present. And they lead to they can lead to very specific things, or they can exacerbate very specific things. But unfortunately, these syndromes are seen all throughout our society. I mean, as I was getting this prepared, I was like, oh man, I think I definitely got it. Like, I definitely need to relax my upper traps and my levator.
Both.
Yeah.
Yeah. I mean, when you think about it, right? You're half our lives were spent as students. And then when we're not, we're always reading or bent over looking at a computer. I mean, all that's going to contribute to this syndrome. I mean,
yeah, at the very least, all day you're working in front of you. And a lot of this is behind you that we need to strengthen and that sort of stuff. We don't get enough of that throughout the day. Right.
And then as far as like the big global exercises, I'm talking about like chest press, pull-ups, row, I don't know, like just global back extension exercise, like Superman's or whatever. Those are not something you want to jump right into right away if you have this, right? Or can you?
So depending on how bad it is, if you're that old lady and your head is extremely far forward, you actually have that kind of Dowagers sign that we were talking about. Dowers hump.
Yep.
If you have all of that, maybe not, if it's not so bad, then sure. But at the same time, it's all about getting the pianist or the
Right.
soloist down first, and then letting that
Before you go to
soloist
that.
participate in the orchestra.
Right. Okay. Okay. Well, it seems like if you don't have this, that at least working those global muscles, and I guess really focusing on your back extensors like rotas pull
100%.
can really help, because most of the time, seems like a lot of people I see in the gyms and stuff are just focused mostly on chest and stuff like
Stuff you
that.
see. Yeah, focus on the pulling stuff for sure. The
Yeah.
pulling
Yeah.
stuff needs to be worked far more because we're constantly pushing in life.
Yeah.
And as far as like you were mentioning, Keoni, that just of how to work them, or just what everyone should be doing. Everyone should be doing the daily prevention. Those scapular retractions, the supine back pushes, the doorway chest stretch, trap stretch, that sort of stuff. And the best part about all those exercises, all of those, I do them in the car. I do them when I'm walking in and out of a patient's room at the hospital. I mean, you can fit these in somehow into your day without much of a disturbance to your routine. And they're going to greatly help you in the long run.
I just lost you, but I think I got
Hopefully
what you
it came
said,
through.
Brian. Yeah, I think it did. We got the gist of it. But yeah, you can do it wherever.
Yeah, do it wherever and easily work it into your routine. Other than that, Keoni, that's all I have to mention.
Cool. All right, that's awesome. I can't
Well,
believe. I mean, I have so many patients who have this, and including myself. I see it in myself. So,
yeah.
And it can cause all kinds of problems.
Yeah, work out your back. Also, check out our salad PDF giveaway in the show notes. If you are still listening, go into the show notes, which is on whatever device or whatever service you're listening to this on. And the salad offer is right there. You can click the link. We just have a little some questions for you in regards to how we can better improve the show and serve you. And then that salad will be delivered to you immediately. Anything else, Keoni?
Nope, that's it. Thanks, everybody.
Awesome, everybody. Be well.